of you know, currently President Obama is lobbying for the approval of a very highly controversial healthcare plan. A highly controversial healthcare plan that embodies the policies that were found within Adolf Hitler's healthcare plan. Barack Obama's healthcare plan is a literal carbon copy of the healthcare policies that Adolf Hitler set in place in the year 1939. And if you think that what I have just stated is some far-fetched theory, then let's see if you continue to feel that way after you hear the facts. According to Dr. Leo Alexander, the key medical advisor during the Nuremberg trials, which were held in Nuremberg, Germany in 1945 through 1946 to prosecute key members of the Nazi movement. In his article in the New England Journal of Medicine, which was published in July 14, 1949, and entitled Medical Science Under Dictatorship, Dr. Alexander stated that in mathematics in the service of national political education, which was a textbook that was widely used for high school mathematics in Nazi Germany, that this textbook included problems stating how the cost of taking care of the crippled, the criminal, and the insane took money away from social programs of housing and family allowances. Dr. Gerhard Wagner, the leader of the Nazi doctors group, stated that the economic burden represented by people suffering from hereditary disease is a danger for the state and for society. In all, it is necessary to spend 301 million Reichmarks per year for treatment, without counting the expenditures for 200,000 drunkards and 400,000 psychopaths. Note that he stated that spending money on those that were experiencing mental illnesses were an unneeded burden on the state. Then, in his article, Dr. Alexander went on to state, all state institutions were required to report on patients who had been ill 5 years or more and who were unable to work by filling out questionnaires, giving name, race, marital status, nationality, next of kin, whether regularly visited and by whom, who bore financial responsibilities, and so forth. The decision regarding which patient should be killed was made entirely on the basis of this brief information by expert consultants, most of whom were professors of psychiatry in key universities. Once again, note that all state institutions in Nazi Germany were required to report on patients that had been ill 5 years or more. And based on the basic information in that report, it was determined if the ill person should be killed. Those were some of the policies connected to Hitler's healthcare in Nazi Germany. Now, the million-dollar question is, does Obama's healthcare plan mirror that sick system? Unfortunately, according to Dr. Betsy McCoy, former Lieutenant Governor of New York, adjunct senior fellow at the Hudson Institute, founder and chairman of the Committee to Reduce Infection Deaths, and most importantly, she is a person that has read the entire House healthcare bill. Obama's healthcare plan not only looks like Hitler's, but it stinks like it too. Listen to this audio from a shocking radio interview with Dr. Betsy McCoy.
Well, first of all, this bill is half paid for with a $500 billion cut in health care benefits and services for seniors. So they're bearing half the brunt of this bill themselves. And this is not a matter of eliminating waste or fraud in the system, because the Congressional Budget Office has already said only 1% of those cuts will eliminate fraud and waste and abuse. That means they're really cutting patient care. And one of the most shocking things I found in this bill, and there were many, is on page 425, where the Congress would make it mandatory, absolutely required, that every 5 years people in Medicare have a required counseling session that will tell them how to end their life sooner, how to decline nutrition, how to decline being hydrated, how to go into hospice care. And by the way, the bill expressly says that if you get sick somewhere in that 5-year period, if you get a cancer diagnosis, for example, you have to go through that session again, all to do what's in society's best interest or your family's best interest, and cut your life short. These are such sacred issues of life and death. Government should have nothing to do with this.